I am here with Dr. Amy Williams. I'm so excited to be able to sit down and talk with you here at Mayo Grit 2019 in beautiful Ojai, California. Dr. Williams is a professor of medicine at Mayo Clinic and a nephrologist. She serves as the chair of the Department of Internal Medicine, and I think it's important to note and celebrate that you were the first woman chair of the Department of Internal Medicine. And then you also achieved the 2018 Mayo Society Lifetime Achievement Award, which I would love to touch on if we have time for that as well. But my goal for today is to talk about the excellent talk you just gave.
Thank you.
Just introduce yourself, some interesting facts about you, and what we just heard you speak about.
I'm Amy Williams, and I am a nephrologist at Mayo Clinic in Rochester. I did my residency there and my fellowship there. Thought I was only going to be there for 3 years, as everybody thinks. Drove from out east, where I grew up, and cried the whole way, thinking I had ruined my life. When the towns got further apart and everything got flat, I thought, where am I going? But I've been there ever since, because it is such a wonderful place to practice medicine. My current role is chair of the Department of Medicine, and it is a ton of fun. There is a lot going on, a lot of innovation, looking at the future of healthcare and defining what that means to really serve more patients, allow people's careers to flourish, and flourish in ways that we've never even imagined, with more virtual care and helping patients where they are instead of bringing them to Mayo Clinic in Rochester. Not everybody can take off work and come to the Mayo Clinic, so how can we better reach them? How can we partner outside of Mayo Clinic to serve patients? It's going to be a very exciting time.
It's really exciting.
Yeah,
And
it is.
I think even in that statement and what excites you about these positions that you hold, it resonates with what you spoke about today, which is having a clear vision of what you want, your goals as a leader, but filling in the blanks along the way, and being a vulnerable leader who may not have all the answers. So how do we do that?
It has to come from within, and we're all vulnerable. No matter how confident we seem on the outside, we are rarely 100% sure that we have all of the answers. And it may be being a physician, where there's so much out there that you need to know. You often know when, I've tapped into everything I know, I need to get help for my patient. It's the same thing with leading in the Department of Medicine, or leading anywhere. Being a leader is to realize that you need other people's help. Everybody has biases. They have blind spots. You need to build a team around you that can fill in those gaps that you have in knowledge and experience, that can give a diverse viewpoint, so that the decisions you make aren't just based on your experiences, but others too. It helps avoid setting processes up that would call for perverse incentives, or the consequence would be perverse incentives. So it's building that team, that team of diverse individuals that have talents that you don't have, that don't always agree with you. In fact, deliberately picking people that you know have a different viewpoint. So they will ask clarifying questions. They will call you out when it is a bias or a blind spot. And as a leader, you have to create an environment that's very safe for them to feel comfortable, not in an insulting way or a nasty way, but in a truthful way of, Amy, where are you coming from here? Or if we do that, here's what will happen, things that you haven't thought about. So the leadership team that we've put together, and notice I say we've because it's just not me, we've put together in the Department of Medicine, makes the job a ton of fun. We do a lot of laughing, often at ourselves. We solve problems together. And the other thing we do is elevate each other, which I think that is a big part of what leaders need to do, is you need to, yes, take credit for what you've done, but give many people, many different people, opportunities to learn new talents, to work in a different environment, to be on teams that need to be innovative and create new things for the better of the whole and for our patients. That is the joy of being a leader, is to organize opportunities for other people to succeed. And then recognizing them as the person that made it happen.
Right.
Not taking credit for what they've done, but I've often told the division chairs in the Department of Medicine, we have 13 divisions, and I've often told them, when somebody in your division, when you've given them a task and they're incredibly successful, bringing a team together, creating something new, being really innovative, and it's translated to help patients, when they go and present this, be there, because that says it's important.
Yes.
Introduce them and let everyone know how lucky you are that they agreed to do this. But let them be the face and the voice of that accomplishment,
Yes.
so that people can see how talented they are, and they will then have opportunities for the next thing. Plus, as the leader, as that division chair, it's a reflection on you, because you picked out this incredibly talented person who got the job done for you. Way to go. And you didn't try to do it all yourself. You had somebody else do it. And I think that's a big part of leadership, is nurturing those that are coming up and that are really defining themselves as leaders, giving everybody equal opportunity to be able to really gain new talents, have new experiences that will allow them to be more confident, allow them to really own their talents and be confident in what they can bring to any table, any board meeting, any leadership position.
Right, and recognizing that makes you stronger
For
as a
sure.
leader, or a rising tide lifts all boats. So to speak.
Absolutely. Learning from people, it surprises you every time. It surprises you how amazing they are. And every day I learn by watching people, whether it's at a board meeting or it's in a meeting with division chairs or other department chairs or on the wards in the hospital. I learn how to be gracious under fire, how to be positive in a time of absolute chaos. And that's the kind of leader that everybody should want to be, to show that you are a positive force and an example of success when the world is so chaotic and the stakes are high, as they are in medicine, because it's about our patients.
Right.
So they're very high stakes.
Yeah, that really resonated with me. You kept emphasizing a positive force in the face of chaos. It made me think of the OR. That's my happy place.
Absolutely.
Being an anesthesiologist, that's when I'm the most calm, is when things are chaotic.
Yeah.
Because it really can bring a team together if you know how to hold people and if everyone knows how to hold each other.
That's
So-
exactly right.
And kind of like being a mom too, or a parent.
Oh, absolutely. There's a lot of chaos there.
Yes, it
So
brings
to be
chaos.
calm
Yes.
and don't blow up at the birthday party.
Right. Right.
Just be calm and talk with a calm voice and lead in the direction that things need to go. Absolutely. It helps in all aspects of our lives. That's
Having
for
that
sure.
endpoint to still go to.
Yeah, yeah. And then you also need to leave the room and be able to just sit there and steam for a while and fume and
Step
just
away.
step away. And we do that in all aspects of our lives. But I do think it's important for leaders, both men and women, to be positive role models. And I always think of when we were residents and you're on call all night and you're exhausted. There were always people in the middle of the night that you dreaded running into because all they did was complain about something, as opposed to the ones that you ran into, and everyone's exhausted, but they were happy. And they spread that happiness just by a smile, by being calm, by congratulating you for what you did. And that's the kind of leader you need to be.
Absolutely.
You need to just spread that joy or happiness and calmness that, you know what, we'll get through this.
Yeah.
Everyone's going to live through the night.
Hopefully.
Yeah, right,
medicine. I had a chief resident once who we just were slammed overnight on call on surgery. I switched from surgery. And I remember he kept saying, just keep swimming, just keep swimming, just keep swimming. And it was so soothing and comforting.
Yeah, you just and you lean in on your strengths. When you're stressed, when there are mistakes, failures, chaos, you go back to what are your strengths. And who do you need to fill in those strength gaps? What
Yes.
strengths don't you have that you need to bring into the conversation in order to be successful?
This is a question I had for you. So there are strength gaps, but what about the confidence gaps? And
Yeah.
how do you know which is which and which one you're filling in?
I would say the strength gaps may be knowledge gaps. So if there is something, I'm not a surgeon.
Yes.
If when I was in charge of the hospital, when there was something that was going on in the surgical practice in the ORs, I knew I had no knowledge of that. So I would go to the people that do have knowledge. I go to a number of them, get different perspectives on it, and then as an outsider, try to put all that information together to come up with some solutions to present, to try to move forward. So I think it's more a knowledge gap
Right.
than a skill gap, because in the heat of the fire, we don't know where our skill gaps are. Although sometimes we do. And it may be, I know I have to have a conversation with a very volatile individual.
Yeah.
And I go to people that are masters at that. And we talk about how I'm going to approach it, what I'm going to say, almost line for line.
Yeah.
What my rebuttal will be if this person comes back and is very, very angry. How do I manage that? So we all have an idea of where we fall short. If we don't, that's big trouble.
Yes.
But we should have an idea, and I think deep down we do. We just need to be brave enough to ask for help.
Yes. The
That is
vulnerability
key.
in leadership.
The vulnerability.
Yeah.
Brave enough to ask for help, brave enough to say you're sorry if there's a misstep. Brave enough to dissect the criticism that you get instead of saying, oh, it's sour grapes.
Right.
Or
Right.
oh, they don't like me anyway. Or they're just mad about this.
Right.
What is the truth in that criticism? There's usually some truth there that if you really dissect it, you can find that truth, and then that helps you be better because you can focus on improving that.
It's interesting. It's sort of a new culture of radical feedback, where leaders are getting feedback and criticism and accepting it to grow and be stronger leaders. And I think it takes vulnerability and courage. And I don't know if that's a trait innate to leaders or something that's new.
I'm going to be quite bold and say I think it's because there are more women leaders.
I was thinking that, and I wasn't that bold. So thank you for.
I do. I think we have changed the
Extracting that
culture.
from me.
I mean, I must say there are some divisions I'll go in and talk to, and they have no problem telling me exactly what they think is wrong.
Yes.
And it's listening, saying, I think I get it. Is this what you're saying? Let's think about that. Feedback about things. Some things I do disagree with, and we'll have a conversation there, but it's not an angry disagreement. It's more clarification of the topic type of disagreement. Or they don't have the right data. So to make sure you share the right data so they can come to a different conclusion. But I think the vulnerability has to do with women changing the environment and allowing everyone to be more vulnerable.
And that vulnerability is not weakness.
It is not
So
weakness.
we have to separate the two.
You have to separate the two. It's honesty, it's transparency. That, I don't have all the answers. I need your help. To engage people to help you is a very great way to solve problems, because then they're involved in the solution. But if they think you already have the answer,
Right.
why would they even bother to be engaged?
Right.
And then they don't own the solution. So if you're vulnerable and you ask for help, you get engagement, and then they help you with the solution, and they're more committed to that solution or to finding a solution.
And do you find with engaging others, you've been able to develop a pipeline for leadership and increase visibility for people?
I certainly hope so. I certainly hope so. I think so. Time will tell. There are some obvious people that are so innovative and wicked smart and are able to move faster than others, and it may be a confidence thing because there are so many people that are so incredibly smart and innovative around us. But it may be how their environment where they are, or the environment before they got to where they are, has tailored their ability to respond in a really innovative and bold way.
Right.
And to put themselves out there and to be visible.
Right.
If you are conditioned not to put yourself out there, not to be a bold thinker, or there's backlash, then you're not going to do it.
And then do you see people that may have at one point in time been a true glass ceiling, but then you run up against so many glass ceilings, you internalize it. And do you find that's something that we have to teach people to, the glass ceiling isn't you
Right. That
or your shortcomings,
yes,
and maybe that's the
I do.
confidence gap.
And that was one of the slides that I showed bullets of just these subtle themes that there may be a glass ceiling there. And so it's recognizing that, this just doesn't quite make sense. We have all these faculty development, career development courses. People go through it. They shine in it. They're given kudos. Yet we don't have the diversity at top levels or even the middle top levels on the way to the top level of senior leadership. Those inconsistencies where it seems to be the same profile of person gets those positions, and others that have the exact same qualifications and experiences, and maybe even better CVs, traditional CVs, don't get the positions. It's that type of thing. Areas where there's less innovation and they're resistant to change, they're more likely to have glass ceilings because that's hard to change the profile of the people around the table.
Right.
And it becomes uncomfortable.
Another theme that I've kind of pulled from a lot of what you've said and from your talk today is perfectionism, chasing perfectionism, or these rigid types and formulas work for a certain time. They have a shelf life and they will get us in trouble. And excellence is more the goal. Having a team building excellence.
I agree 100% that we should never strive for perfection. And in fact, last year at Grit, in my talk, there was a focus on how we hold ourselves back. Now, it doesn't mean that we haven't been conditioned to do that because of the environments that we've grown up in. But the imposter syndrome is a great example of that. Or the always comparing yourself to the person next to you and never as good as that person. Even though you might be better than that person, and everybody thinks you're better than that person, you don't think you are. And it is because you're looking for perfection. Nobody is perfect. They can put on a show and make everybody think they're perfect, but you know nobody's perfect. So don't believe that and don't strive for that because you'll always disappoint yourself. And failures in the old days would lead to losing your job.
Right.
Now failures show you took a risk, you were innovative, and you caught it in time. So it's not a big failure that destroys the company or kills a patient. But you've learned from that, and now you're moving forward in a different direction that is more likely to be successful. And realizing that it's okay to misstep, it's okay to have failures. Don't strive for perfectionism, because if you do, you will never learn.
Right.
You will never learn.
It's like medicine.
It is like medicine.
If we don't know the answer in many cases and we're doing an evaluation, we're diagnosing as we treat as we diagnose, and in hindsight, it's always, obviously.
Yeah,
That's
right.
what
In hindsight, it's why did we even think about that?
Right.
But in the moment,
Right.
you don't have the data.
And how do we learn?
And how do we learn?
And how does each and every patient give us that gift of learning?
That's right.
If we were perfect with every diagnosis, and again, problematic term, I think we're excellent in achieving our diagnosis.
That's right.
Yeah.
To be as excellent as you possibly can be. And that means to be bold, to be innovative, to be honest, to work with pure integrity, to bring others along with you, to make sure that your true north or your goal is for the betterment of everybody, of the organization, for Mayo, it's for our patients. It really is for our patients. And I think these days it's to save our profession.
Yes.
That we have to be excellent. The care we give has to be excellent. We have to grow the next generation of individuals in a way that they can meet the needs of the future, that they have the skills that they need, and it's not just medical skills, it's true communication skills.
Right.
It's the empathy, it's understanding patient populations, digging deeper under the surface for why a patient is struggling. I have to say this because this is a quote that sticks with me forever, and it's a good example. So, in a previous role, and my current role as a nephrologist, I do a lot of dialysis. And a number of years ago, CMS was putting dialysis care in a bundle payment. It's always been paid for performance and capitated, but it was becoming bundled. So to be successful, we realized that we need to understand how we could help our patients be successful in managing this complex chronic illness. So we got a designer in to live with patients, to go into the hospital with them, go through transplantation with them, come to dialysis, go grocery shopping with them. They have such a restricted diet. And she came out with a number of personas of patients, and across all the personas, the 8 personas, there were 5 different influencers for the patients, and that became our North Star. How do we actually focus on those influencers or tools that patients need to be successful? But the quote that haunts me to this day is, patients don't get vacations. When you think of that, it gives me chills now. And when I think of the patients, my career has been managing individuals who have very complex chronic disease, kidney failure for some reason, either a catastrophic illness or multiple comorbidities. They and their families never get a vacation from that. So how do we lessen that burden for them? And I think that's our role as medical professionals, that's our true north, is how do we lessen the burden for our patients? And I internalize that in all of my leadership roles at Mayo because that's our ultimate goal. And part of that may be to allow diverse populations of physicians to influence how we practice, to lead and not be burnt out.
Right. And part of that burnout is having the joy in doing it. And when you said that patients don't get vacations, that kind of sparked that joy inside of me, like we have to help them.
We do.
That says it perfectly. It's really beautiful. It
is
heartbreaking, but it brings us back to that North Star.
It does. I use that often. That's it's not the title of my talk, but it's the first slide. If it's the title, the audience has already been shocked. But if it's the first slide, the audience is shocked right there with, yep, that's it.
Right.
That is what we need to focus on.
Absolutely, and it always puts things into perspective.
It totally does.
Very lucky to have a career that does put things into perspective.
Oh, we are. We are. Every day our career puts things into perspective for us.
Yeah. One quote you had was, never be fearful when you know you're doing something right.
Yes.
So if you're in the middle of the night thinking, my patient doesn't get a vacation, I'm acting with that in my heart, no action you do could possibly be wrong.
That's exactly right.
No team you're leading toward that goal could be doing something wrong.
Exactly. That is exactly right. Yep. If your motivation isn't altruistic, is more personal, is narrow, then it's not the right motivation. And you should be fearful about changing things if you're the only one who's going to benefit from it, or you're a small group. You should never be fearful if your motivation is to improve things for populations of people, for all. Never. And then you can be bold, stick your neck out, get into trouble a little bit,
Yes.
and then recover.
But it's so interesting that there are barriers to motivations
Is
that altruistic.
It is.
And there
It
are.
is. There are. I think some of them were conditioned for that. The other is there's so much chaos out there right now, and people are working so hard that you don't want your career to be all about survival.
Right.
You want your career to be meaningful, to be aligned with true values that you think are important. Not, I just have to survive. I just have to get
Right.
through the week. I just have to get through the night.
Right.
It's why are we really here?
Well, this has been an amazing conversation. I could go on for hours.
Oh, I could talk
asking you
about this
these
for,
things.
but isn't that the patient never gets a vacation?
It's
Or-
really
I
what
mean,
it's all about.
It's what it's all about. And when I think about the incredibly amazing people that I care for on dialysis with very complex disease and their family members, they are so brave.
Oh, I know.
And they take chances every day. And if there's any way that we could lessen their burden so that they can manage their disease better and not spend all of their energy on their disease, but on the rest of their life, that's a goal. That's a great goal.
That's what really makes me love doing transplant. Is you
Yes,
see that moment,
You see that.
and they might be about to go on vacation.
That's for the first time.
Yeah.
They don't have to go to dialysis 3 times a week or 5 or 6 times a week, which is almost like a job.
Yeah.
And they feel better.
There's that moment before, we go to sleep, and I just say, congratulations. Like,
Oh yeah,
I'm super excited for you.
I know. I exactly. And to see their face, I'll often get texts from patients after they've had their kidney transplant. Oh, you won't believe it. Look at this urine. They take a picture of their
I
urine.
know. It
true,
gives me
though.
chills. I'll be vulnerable. I get misty every time we do
Oh,
a
I do.
transplant. I just think it's amazing.
And you should.
I know the science behind it, but it's magical. That
I think it is magical, and
We
it's
can care for
magical
people like
that,
this.
especially if someone donates a kidney. I mean, really, that's what it's all about.
well, thank you for doing all
You're
you do.
welcome. Thank you for doing
talking
all
to
you
me.
do. Thank you for taking care of those patients that are getting that kidney transplant.
Yeah, it's a real privilege.
That brings joy to me when I can
Yeah.
help others. Honestly, there is a calmness when you don't aspire to another higher role, and you can feel that you can focus on just doing the best in that role with no consequences. And I mean, what can they do? Tell me I have to be a nephrologist? I love being a nephrologist. So
Win-win.
So it's a win-win.
Right.
But there's a calmness. My husband and I talk about this a lot. We live out in the country and we have black labs. So we'll go for a walk in the meadow. And he's a gastroenterologist. And we'll talk about this, how you just feel the only job you have is to do the right thing.
Yeah, that's a really beautiful place to land when you can begin to grow outward
Oh.
instead of up.
Right. It's not
And
about
share.
And share.
Yeah.
It becomes a point in your career. It's not about you anymore.
Right.
Yeah, it's about you in that you might feel better when you go home at night if it was all success during the day, as opposed to worry about things. But it's nothing is about you. It's all about how to make things better for others,
Right.
ultimately for our patients.
Right.
There's a freedom about being able to be bold and ask questions that you may not have asked at another place in your career.
Yes. And when the glass ceilings are gone, or you don't care about them anymore, maybe, and you're just growing where you are
That's exactly
and helping
right.
others to see their ceilings.
That's right.
And I
Yeah.
think that's just amazing.
Yeah, it's fun. It's
very
a lot of fun.
inspiring.
Thank you.
All right, well, maybe there will be a part 2 and 3.
Okay, there you go.
We'll
Anytime.
just keep bringing you back.
Anytime.
All right,
All right,
thank you.
thank you.
Thank you so much.